Let's just pick up, though, with that review that the Prime Minister is talking about the 2-metre social distancing rule. We heard from the Prime Minister on a trip to the Westfield shopping centre. Let's just look at the science in a bit more detail, because Dr Bharat Pankhania is Senior Clinical Lecturer at the University of Exeter. He has more than 20 years' experience in communicable diseases, control and infectious disease management. Thank you very much for joining us on BBC News. Let's just be clear. I mean, the science says what? You know, if you are going to go from 2 metres to 1 metre, it is going to be more dangerous, or is it not quite as binary as that?
It's not quite as binary, but the greater the distance between fellow human beings, the better. And the United Kingdom picked a 2-metre social distancing, a good idea. The Europeans picked 1.5, that sort of range. I always feel the greater the distance, the better. There is nothing we can do. The government has decided it wants to make it 1 metre. Nothing we can do. And my advice to our viewers, listeners, and anyone is be careful. So if you are in an at-risk group, be very careful. Otherwise, if you're going to be closer to people, wear a face mask, a face covering, or something like that. The closer you get, the greater the risk. You've got to be careful.
And so the chances are the R number will increase. More people will, unfortunately, get coronavirus, even with a face covering.
Unfortunately, with respect to lifting the lockdown, which I also feel is premature, I'm so sorry to be disagreeing with Prime Minister Johnson. I'm not here to disagree, but the evidence is there. It is too early to lift the lockdown. What can you do? It's going to happen anyway. Therefore, I say, yes, of course we will expect more cases because the background level is high. People will get infected as they move around and mingle with each other.
This is under review, as the Prime Minister was saying, but ultimately, you know, it is a political decision. The economy has been hammered by events so far, and they need to pick up, and many more millions of jobs potentially are at risk. So in terms of a pragmatic decision, surely you as a doctor, as a scientist, as somebody who studies these things, I mean, that is the trade-off, isn't it?
Yes, and hence my additional advice, which is inevitably it's going to become 1 metre, and therefore the closer you approach to fellow humans, the greater the risk. Mitigate against this risk. It's not 100% fail-safe, but if you wear a face mask, it reduces the volume of infectious droplets that may be coming your way. So the closer you get, the greater the precautions you must take. Wear a mask, wear a face covering. OK, just help us out with something as well. I mean, there was a report out a few days ago, and a lot of newspapers had it as well. 95% of the people who have died from coronavirus had underlying health conditions. If you have an underlying health condition, would you not follow this advice? Would you actually keep to 2, 3, 4 metres distancing? Yes, absolutely. So the at-risk people, and they really need to be advised, informed, and let them allowed to make their own informed decisions, but at least advise them. So if you are in the at-risk category, lie low is my absolute advice, because we don't want you to get infected by chance.
All right, OK. Dr Pankhania, thank you very much indeed for joining us here on BBC News.